Yeah, today we will discuss about the pelvic fracture and different types of pelvic fracture and the application of the pelvic binder. So before we start, uh, whenever we see an pelvic X-ray, there is an approach to the to find any fracture sites. So here we will discuss one by one. So whenever we see an X-ray, we should always go in this manner. Just I will explain here. So the number one point what you have to do is like you have to see any fracture line in the pelvic ring. I'll just mark it with colors. So number one will be seeing the inner, this is called inner pelvic ring. Yeah. And coming to number two, so we have to start from the iliac crest. From here, acetabulum, this is acetabulum, and it goes to ischium till pubic symphysis. So this is the second line you have to see for the fracture line. And coming to number three is the obturator foramen. You have to see the both foramen if there is any fracture line is or not. And coming to number four is the sacrum and sacroiliac joints. So this is sacrum, and you have to see the sacroiliac joints. And coming to number five is sacral foramina. You can vaguely see here, this is the sacral foramina. So if there is any discontinuation in the foramina, so you can suspect a fracture here. So each foramina has a line above it called the arcuate line. So this yeah, right. And number six is the, you have to look for the lumbar vertebrae whether it is inline or not. Check for any fractures over the transverse process, right? This is a transverse process, yeah. Then this one. And number seven is the check for the femoral outline from here to here, both sides and both femoral bones. And while examining the femur, always check whether the head is inside the acetabulum, both sides, right? And number 8 is like the medial border of the femur bone, and this line, what you call it as the Shenton line. This is the Shenton line. So this is the imaginary line run from the inferior border of the superior pubic ramus to the inferior medial border of the neck of femur, and this line should be continuous and smooth. So if there is any discontinuation, maybe there is a loss of cortex or there is a fracture. So now let's move on to different types of the pelvic fracture. So normally pelvic fractures can be divided into stable and unstable fractures. So in the stable fracture, you can see there is a ramus fracture, inferior ramus and superior ramus fracture you can see, or there is a iliac wing, fracture. And in the unstable, you can see open book fracture, vertical shear, and and lateral compression. Open book, vertical chain, lateral compression fracture. Now let's move on to stable pelvic fractures. So this is the pelvic X-ray, and this is the stable fracture. As you can see, there is a fracture here and here, superior and inferior ramar fracture. And the next one, this is also a stable fracture where you can see the fracture of the iliac wing. So there is a discontinuation of line here, and this is the fracture line. Yeah, these are the stable fractures. And the third one, this is very easy. This is the open book fracture. Open book fracture, which is caused by the anterior posterior, which is also called anterior posterior compression fracture, where the patient have the compression forces from anterior to posterior. And what happens in this fracture is like there is a large gap between the pubic symphysis. This is the unstable fracture what we are talking about. This is the highly unstable fracture. Why? Because of this suppression of the pubic symphysis. As you know, the pelvis is a area where there will be a lot of vasculature and many capillaries will be there, and when this type of fracture happens, patient will be losing lot of blood. And that's why it is very important, especially these patients, they will immediately go into hemorrhagic shock, and it is very fast. And next one is the vertical shear fracture. In vertical shear fracture, what happens? Suppose a person falls from height like 4 to 5 feet or 5 to 6 feet. Suppose he lands on one limb, suppose this limb, and the force on which leg he lands, that will be carried through this leg, and this will cause, as you can see, this segment will be pushed upwards, and this remains stable, and this part remains stable, and this will be pushed upwards. That is why it is called vertical shear fracture. So this, as you can see, this X-ray, this half of the pelvis is shifted upwards. So if you want to confirm, there is another method. You can draw a line where this is the imaginary line, where this straight line should always be meeting the superior part of the both sides of the pelvis. So now it is shifted a little bit, so it is vertical shear fracture. And the next one is lateral compression fracture. This is called lateral compression fracture, where the force is exerted laterally from this side. What happens when the force is exerted laterally? This part of the pelvis will be rotated inwards, as you can see in this direction. Therefore, you can see in the X-ray there is a fracture here, fracture line, and you can see superior and inferior ramus fracture is also there. This is the typical presentation of the lateral compression fracture. Yes. And now we move on to sacral fracture. Normally these sacral fractures are hard to see in the pelvis x-ray. Usually these sacral fractures, if you want to diagnose this type of fractures, normally we do CT scan, CT pelvis, to confirm these fractures. So according to this x-ray, see, this is the sacral line what we have discussed earlier, and here you can see the fracture line, this part. And now we move on to the pelvic binder application part. So this pelvic binder, there are steps to apply pelvic binder. Pelvic binder should be applied only in the open book fractures. We can't apply for the lateral compression fractures, because if you apply for the lateral compression fractures, you are causing more damage to the patient. So already there will be a damage to some vasculature if you apply fracture, if you apply pelvic binder to lateral compression fractures. So more number of blood vessels may get damaged and immediately patient may collapse and die. So this is, pelvic binder should be applied only to the open book fractures. So how do you apply the pelvic binder? So number one is, I'll tell here, yeah. Number one is position the patient first. Position the patient. So you should have the patient lie on their back with the legs straight and together. And number two, remove any clothing, because this might interfere with the binder. And number three, this is very important, position the binder. How do you position the binder? So what you have to do is, first you have to get the binder under the knees. Should not lift the pelvis up, because it is already fractured. You will get the pelvis may get more damaged if you disturb the pelvis part. So under the knees you have to place the binder, and we have to slide it up. You have to slide the binder up to the level of greater trochanter. You can see this one, greater trochanter here. So you can palpate your greater trochanter. Yeah. And this pelvic binder should, here it has been written, do not place the cover over the iliac crest. See, already in this example already it is fractured here. If you place it here, this fracture may get worsened. So always place over the greater trochanter. And number four is, after placing, tighten the binder according to the manufacturer instructions. So one more important point is, you should not you should not bind the pelvic binder too tight or too loose. And number five, what you have to do, you have to record the time. So when did you apply the pelvic binder, you have to record the time. And number six, what you have to do, after applying the pelvic binder, after recording the time, now you have to perform neurovascular observations. So like initially the BP was around 80/60. You have given fluids and now it became 160. You have applied the pelvic binder, and after some time again you have to check the BP whether still the BP is low or it is stable.